We're going to be talking about communicating with the person and understanding their needs. It is extremely important as a CNA that we learn how to communicate well, not only with our residents, but with their families, with the members of our healthcare team, with physicians that happen to come in, with anyone that's there at the facility where we're working. It takes good communication and empathy and understanding to be able to accurately care for another person. So when we're looking at caring for another person and good communication with that, one of the things that we will be talking about here is that we need to look at a holistic approach for a person. They're more than just a diagnosis. So it's never just the gallbladder in room so-and-so or the knee replacement in so-and-so. We always need to learn who our residents are, how to best approach them, what they prefer to be called. So generally when you're meeting a person, we are going to always introduce ourselves. We're going to tell them who we are and what our title is. So as a CNA, you do not go in and meet someone and say, "Oh, hi, I'm one of your nurses today." You are the certified nursing assistant. When we meet the person, we're going to call them Mr. Smith or Mrs. Smith. We're going to call them by their full title, and then we will ask them what they prefer to be called. Now, in a hospital setting, we refer to the people we care for as patients. In a nursing home, we refer to them as residents. If we do home care, they're generally referred to as clients. But they're more than just that diagnosis they came in with. We have to look at the whole picture. We have to look at their emotional needs, their physical needs, how that diagnosis that they have, how it impacted other systems in their body. So all of that is important. Now, in a nursing home and in a hospital, people will always wear identification bracelets. So when you work in a hospital, you will never find a patient that doesn't have an ID bracelet. So you can always confirm that you have the right person by checking their ID bracelet. In a nursing home, a lot of times the residents will have them, but a lot of times they take them off. Again, remember, this is their home for many of them, and they don't necessarily feel they should have to wear an ID band all the time. So some of the residents end up taking it off. What you're going to find in nursing homes is they will take pictures of the person and put it in the front part of their chart. So you can always, go back to their chart and look at that picture to make sure we have the right person. We also, when we're trying to identify our patient correctly, we're not just going to say, "Are you Mrs. Smith?" Anyone can answer yes to that. We can say, "Hello, could you please tell me your first and last name?" And then when they say it's Alice Smith, then you can say, "And what do you prefer to be called, or how would you like me to address you?" Now, Maslow he was a psychologist or psychiatrist. I forget sometimes. But anyway, he came up with the basic hierarchy of needs. And it's basically a pyramid. And what his pyramid says is that your physiological needs need to be met before anything else can happen for a person. So food, shelter, water, clothing, if those needs aren't met, the rest of the pyramid is pretty worthless, because if a person's food, shelter, clothing, if their basic needs aren't being met, they're going to struggle to survive. Next comes safety. Everybody has the right to feel safe and secure in the environment where they're living. So we're always going to try to keep our residents as safe as we possibly can, and make sure that when we're caring for them, that we give them that sense of safety, that they're being watched out for, and that they're in a secure area. Love and belonging. People need to feel like they have a sense of community. So when we're a patient in a hospital, generally most patients in a hospital only stay around 2.5 days. But in a nursing home, some of these residents will be there for a few months while they're going through rehabilitation. Some will be there for the rest of their lives, and they need to feel connected. They need to feel like they belong somewhere, and that they're cared about, and that we care for them. So they need a sense of love and belonging. If those three areas of the pyramid are met, then generally most people will have good self-esteem. Now keep in mind, when we're taking care of someone in a nursing home, that a lot of these residents, the reason they're in a nursing home is because they have multiple disabilities that have impacted their ability to do their activities of daily living. So with that being said, a lot of that can impact their self-esteem, their sense of self-worth. If they can no longer care for themselves, they can no longer feed themselves, clean themselves, their sense of self-esteem may be impacted. So being very careful with that love and belonging, trying to help them make choices, trying to let them do as much for themselves is very important. Now, if those 4 rungs of the pyramid are met, then people hopefully can get self-actualization, and that's reaching your full potential. That's being the best basically that you can be. And so generally in a nursing home, we're really kind of focusing on those physiological needs, the safety needs, the sense of community, the love and belonging needs. And if we do that, hopefully the self-esteem will still be there. As far as culture and religion and how that impacts communication, well, you have to remember that a person's culture and religion, culture is characteristics of a group of people, language, it's their values, it's their beliefs, it's their habits. So that is definitely going to impact their behavior during illness and how they want to be cared for during that illness. And then religion relates to spiritual beliefs and needs and practices, and those can impact how we care for a person as well. We always try to incorporate the person's culture and religion into their care. Don't ever be afraid to take care of someone who has a different culture or a different religion. If they are, if they have a different culture, a different religion than you, it's wonderful to learn about other people's culture and religions. Don't be afraid to take care of someone because they have a different belief system as you. But we will always try to incorporate that person's belief system into their care wherever we can. Now, if we feel that the culture or the religious beliefs are going to be detrimental to their care or detrimental to the care that we are giving them, then it's going to end up having to go through the physician, and then we'll have to work something out with them. But generally, for most people, we can usually incorporate their wishes into their care. Some types of people we may be caring for, depending on where you work. If you get a job in a hospital, you might work in a maternal child health area where they do obstetrics, where they deliver babies. Pediatrics, they will hire CNAs to work in the pediatrics department. Pediatrics, you work with children. Psychiatry, okay, helping out with patients that have mental health problems. Bariatrics is caring for a very large or very obese patient. And then geriatrics is generally what we do in the nursing home. Geriatrics is care of the elderly person. And that is can be extremely rewarding. And it's something that if you are working in a nursing home, that is the primary type of patient we generally take care of. Medical patients are patients that come in with medical issues, medical problems, and then surgical patients are patients that are coming in specifically for a surgical procedure. So when we're communicating with a person, we want to avoid medical terms. Now, I say that, and at the same time, when we get into a couple more chapters, we're going to talk about some medical terms, and we're going to be learning common abbreviations, and we're going to be learning common words, medical words that you will use in your nursing career. And at the same time, I'm going to tell you, when you're communicating with your resident or your patient, avoid medical terms. Not really sure sometimes why we need to learn them, but it is part of medicine. So we are going to be learning some medical terms. When we talk with the person, we want to use the most correct terminology that the person can understand. We want to be logical and orderly. And we want to talk to them in a way that the information we're presenting makes sense to them. Be brief and concise. Always show them respect and respect their religion and culture. We may need to repeat information as often as needed. So a lot of times when you're communicating with someone, especially, for instance, let's say the doctor just came and visited the resident and told them that they had a new diagnosis that's not very good, they aren't going to really be able to process any more information. So a person may have to have information repeated frequently for it to sink in. And then we can stop and ask them questions to make sure that they understood the information that we're actually passing on. Not just, did you understand, but okay, can you tell me what I mean by this? Or can you explain what this is? So you know that they've actually understood the information. Verbal communication is using your words. So we face the person. We always try to position them at eye level. So if they're in a wheelchair, try to kneel down, try to squat down so you can come at eye level, or bring a chair up and have a conversation with them so you're not just towering over the person. We don't use slang terminology. If you are asking a person a question, ask one question at a time and wait for a response. Okay, don't ask 15 different questions, and then they're going to be so confused they're not going to be sure which one they're supposed to answer. So one question at a time and let them process it. One thing you need to keep in mind with our elderly population is it may take them 60 seconds, 90 seconds to even process what you ask them. So it may take a little while before you get a response. So just be patient. Be courteous and friendly. And if the person can't hear, we may need to but they can read. We can write out questions. We can write out information. We just need to make sure we're writing legibly. And then they also make communication boards that you can point to pictures. So this, for instance, is a communication board, and the person is taught how to use it. They can just show some, these are common things. They want the remote, they want a glass of water, they want to be comforted, they want sleep. I mean, they can just kind of point to some of the things that they want, so you're not having to write out all the really common things. As far as nonverbal communication, I am going to tell you that nonverbal communication is probably the biggest thing that you use to communicate with another person. Your words, you can say anything you want, but the tone of how you say it, your mannerisms when you're talking to them is going to make a huge difference. So be careful of mannerisms. Use touch to the person's comfort level. So a lot of people have a personal space issue. And some people are very touchy and huggy, and some people are not. And you need to pay attention. So when I meet a person, I will almost always touch them. I always touch their hand or touch their arm just to make that human contact with them. But if I see them pulling away from me, I see them moving their arm away from me, that I need to pay attention to that. That's telling me that they're not comfortable with that. I worked with a girl. She was a wonderful, wonderful nurse. And we worked together. And anytime she would see me, she was like, "Oh, Kelly." And she would just come up and she'd hug me. And every time she talked to me, she had her arms around me and was touching me. And if I was not comfortable with it. I mean, I would just kind of want my own little personal space. So she would come into me, I would take a step back. She would take a step forward, I would take a step back. She wasn't paying attention to the cues that I wasn't comfortable with it. So you need to use touch. Touch is very important in nursing, but it has to be to the person's comfort level. And if I do touch someone and I see them pull away from it, I'll say, "Oh, I'm sorry. I didn't mean to make you uncomfortable." And then the other thing I have found, as I used to be, I mean, if someone would be crying, I was like, "Oh, you need a hug," and I would just hug them. You have to be very careful nowadays. People can misconstrue things, and so generally if someone's crying, they're really upset, I'll say, "You really look like you need a hug. Is that okay?" Before I just automatically do it. So really you need to pay attention to body language, your body language and their body language, because it is one of the biggest indicators of the communication that's happening. And we need to actively listen. Because when a person's telling you something's wrong, or a person's telling you something that's going on with them, you need to engage. You need to listen. You need to hear what they have to say. So be an active listener. Pay attention. Now, some communication methods, listening, again, I cannot stress this enough, being an active listener, listening to them. Paraphrasing, that's where we restate the person's message in your own words. So they're telling you this big long story, and it's like this, you think you understood that they mean this. So I'm going to paraphrase it in my words. What I hear you saying, what I'm understanding is blah, 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 blah. Is that correct? That would be paraphrasing. Now, clarifying can be similar. Clarifying lets you make sure that you understood the information. Let me just clarify. I'm not sure if I understood you when you were telling me about this. Is this what you mean, or did you mean this? So that would be clarifying. Direct questions are asking yes and no questions, or one-word questions. So if I asked you, "Do you like homework?" That is a direct question. You're either going to tell me yes or no. An open-ended question would allow the person to elaborate on their answers. So an open-ended question, I might say, "What kind of homework do you like best?" Because then you would tell me about that type of homework. Focusing, you may have to redirect them back to the topic you're learning about. So for instance, if the person is telling you this big rambling story and you need a specific answer, you may need to focus them back to a direct question to get the answer that you need. And silence. You guys, silence is a good thing. You don't always have to be talking. Someone does not always have to be talking. It is okay for silence to happen. If the person's upset, if they've been crying and now they're calming down and they're just kind of quiet, silence is an okay thing. So don't feel like you always have to be talking or that you have to fill up that silence. As far as communication barriers, using unfamiliar language or unfamiliar terms. So using this medical terminology that they don't understand and maybe they're embarrassed to ask. Cultural differences. Some cultures feel touch is very offensive. Some cultures feel that good eye contact is offensive. And other cultures feel if you don't make good eye contact, you're being offensive. So cultural differences can play a big role in communication. Changing a subject when the topic's uncomfortable. I've seen nurses that, the patient's talking about how they feel. They found out they're dying and they're upset and they're crying and they're talking about how they feel. And the nurse just tries to change the subject because it's uncomfortable for them to talk about it. They need to be able to talk about these things with someone. And you're a nice, safe person for that to happen. Giving your opinion when it's not asked. You guys, giving your opinion about things is not a good thing in nursing. Okay, that's not actually a good skill of communication. Talking a lot when others are silent, not listening. And then another barrier to communication is pat answers. Don't worry, everything's going to work out. It doesn't always work out. Everything's not always going to be okay. And, I know exactly how you feel. You don't know how another person feels. You can empathize with them. You can have a general idea of what they might be feeling, but you don't know exactly what they're feeling. So pat answers are not appropriate. Other things for communication barriers, their illness or their disability. Let's say they've had a stroke and they have speech issues now, or their words are slurred now, or patients with Parkinson's, their speech gets really quiet sometimes and it's really hard to hear. So there are a lot of things that could be potential communication barriers, and we need to just be aware of these and try to limit as much of them as we can. Now, people with disabilities, a disability is any lost, absent, or impaired physical or mental function. So just kind of remember the old golden rule. How would you want to be treated if it was you, or if it was your family member who has that disability? How would you want them to be treated? Our goals in nursing is always to return the person to their highest potential level of functioning. So our goal is always going to be to get them to their best level that we can, their optimal level of functioning that we possibly can. And we start thinking about rehabilitation as soon as admission happens. So when a person gets admitted to a facility, whether it's a hospital or a nursing home, we're going to start looking right then. What do we need to do to get that person better? What do we need to do to get that person, past their problems, or get over or get past this disability so they can function? A person who's comatose is a person who is unaware of their surroundings. So they're breathing, they're alive, they're breathing, their heart's beating, but they cannot respond to you, they don't wake up, they don't talk to you. But it has been well documented that hearing may still be present. And so always explain things to them. Always talk to them, explain things to them, treat them and touch them gently, and show them the same courtesies you would if that person had been awake and alert. As far as family and friends go, you guys, we're not there to care for the family, we're there to care for the patient or the resident. But patients have a right to have their friends and their family present. So we still have to remember privacy when we're giving care. We want to make sure we're treating all visitors with courtesy and with respect. So if you have a person, so let's say you have a person who they've been really upset, they've been really anxious. If we kick their families out, that's just going to make them more upset and more anxious. So letting the family come in is always usually beneficial. Now, As far as treating with visitors with courtesy and respect, I will try to find chairs for family members. I'll try to get them something to drink if they're, if they're really thirsty, or I'm bringing something in to the resident. I mean, it's just going to make people feel better. But let's say you have a 2-patient room. So let's say you're a resident in bed 1 and you have a resident in bed 2. And bed 1 has all of these people in there visiting with them, and bed 2 needs to use the bedpan. It is okay to ask family to step out, okay? The person in bed 2 has the right to privacy, and they're not going to want the room next to them and the visitors to be hearing everything that's happening to them. So it's okay to have family step out when you're giving care. Now, one thing I always keep in mind with family as well is some of these residents in the nursing home, they don't have family come a lot. So when they do, it's really important to them. So if a family is there and I need to give care to my resident, I will just usually ask, I'll say, oh, it's so nice to see you. And I know they're so, Mrs. Smith's been so anxious to have you guys come, or so wanting you to be here. And I do still need to get her cleaned up. So how long are you going to be here all day? And if you're going to be here all day, just let me know when's a good time for you to have you step out for a little bit, and I'll get her cleaned up, and then you can come right back in. Or if they say, oh, we're only going to be here for an hour, then I'll just plan her care in an hour. Okay, I'll go do someone else and come back and get her at a later date. Because when you tell a family member, if they're only going to be there an hour, you say, oh, can you step out while I get them cleaned up? A lot of them will just say, oh, well, we're just going to take off then, and they'll leave. And that is it's just crushing to the patient. So always try to allow them to have their visitors whenever possible. Some behavior issues that we see, there's anger, there's aggressive behaviors, there's demanding behaviors, there's withdrawal, there's inappropriate sexual behavior. If a patient's angry or aggressive, so one thing that we need to learn with anger and aggressive behavior is if they are being aggressive to you, you need to get out of the room. I'm going to just tell you that right now. I'm not just saying, oh, the patient's irritated with you and they're complaining to you. But if the patient's aggressive and they're like shaking their fists and they're almost taking an attack type of stance with you, you do not go up to them and say, oh, it's going to be okay. You get out of that room. You get out of that room and you get some help. Now, residents a lot of times and families do get angry with the nurses because they don't feel that their care is fast enough or good enough, or they're not getting better quick enough. And it's not really that they're angry at you. They're just angry at the situation. They're angry at the events that's happening to them. And you're a safe person to take it out on. So you have to keep that in mind. But when aggressive behavior is involved with, you need to get out of that room. Demanding behavior, if we have someone that has really, really demanding behavior, sometimes we need to set limits with them. We'll say, okay, here's your call light. I took care of this for you. We will be back in an hour to check on you. Okay. Do not use your call light unless you're really having trouble, because sometimes people, especially when they first get into the nursing home, they'll be on that call light every 2 or 3 minutes, and you can't be in there all the time. And then what happens is people start ignoring that call light because they know the person's just really demanding. And then when they really do need that help, it may be delayed. So we have to kind of start setting limits sometimes if people have an overly demanding behavior. Some people withdraw. One of the things that we're going to see when we get into the nursing home is sometimes when patients are admitted to the nursing home, they have what we call failure to thrive. They're depressed and they're sad. They've got these disabilities now that's keeping them from doing their own care. Their family can no longer care for them. They're put in a nursing home. They don't want to be there, a lot of them. And they literally just kind of withdraw. They quit eating. They quit participating in life. It's very, very sad to watch. But it does happen. And then as far as the inappropriate sexual behavior, one thing I'm going to tell you is I've had students where I've had male residents try to pinch their boobs or pinch their bottom or say something suggestive to them. You need to just say, please don't say that, or please don't do that. That's inappropriate. And then if it still continues, let your clinical instructor know, and we'll go talk to the patient, or we'll just reassign you to someone else. If you're not in a school setting, you're actually working there at the facility, again, usually you can take care of it yourself. Generally, if you just say, you know what, that's not appropriate, I don't appreciate you trying to touch me that way, please don't do it, or we'll need to talk to the nurse about that. And then if it continues, you go talk to the charge nurse. As far as dealing with behavioral issues, one thing we have to remember when we're dealing with patients and residents is it's very frustrating. I mean, you're not in your own home. You can't do the things you normally do. You have disabilities now where you can't care for yourself. It's frightening. It's scary. It's frustrating. And so it's something that sometimes people just tend to lash out at nurses because, like I said, you're a safe person for that to happen to. You still have to treat them politely and with kindness and with empathy and try to realize what they're going through. Treat the person with dignity and respect at all times, even if they don't treat you that way. And treat all the staff with dignity and respect. Answer questions clearly and thoroughly. Always keep the person informed. It's, you know what, when you need help and you're having to wait for it, that's what people get so angry about all the time. They put their call light on. Well, you have 7 or 8 patients, and maybe you're in the shower with one of your patients, and you might be in there for a half hour, 40 minutes, and that person put on their call light to go to the bathroom, and nobody answered it for 35 minutes, and they're angry. You know, it's hard. It's hard in a nursing home. It's a very, very busy, very busy area, but try not to keep the person waiting. Try to have good work relationships where other CNAs will answer your call lights if you answer theirs. When they're in the showers and stuff, you need to kind of build up that type of work relationship. Stay calm. Don't argue with the person, even if they're trying to argue with you. Listen. It's okay to use silence. Protect yourself from violent behaviors. Get out of a room if a person is violent with you. And if there are bad behavioral issues, make sure you're reporting them to the nurse. So in conclusion, we have to remember that we're taking care of people when they're sick, they're in pain. Try not to judge them or be hurt or by their angry outbursts. Try to stay calm. Try to provide good comfort measures. Okay? Good communication goes a long way. The other thing I'll say as far as good communication goes and that waiting is one of the things you can do as a CNA to really build up a good trust relationship with your resident is when they ask you for something. So let's say they ask you to go tell the nurse that they're having pain and they're ready for their pain medication. You go tell the nurse. You're not sure when that nurse is going to get in there exactly to do it. So go back and tell the patient, hey, I told the nurse, if she's not here within 20 minutes, please just put your call light on and let me check for you, okay? But if you just go report it to the nurse and then you take off, you don't go back and let the patient know that you actually did what they asked you to do, and then that nurse doesn't get in there for an hour, they're going to be wondering if you even did what you said you were going to do. So always try to make that connection. Always try to be really good with your communication skills. It helps build trust. It helps build good work environments and good rapport with your residents. And we will end on that note.